Hi guys, today I would want to discuss about heartburn. Heartburn, many of you would have had experienced it in the past. Now what is heartburn? It has nothing to do with your heart. Heartburn is basically a complaint where you have a burning sensation at the center part of the chest region, or it could also be some form of pain or some form of discomfort. Now especially it can occur after food, what we call as, in the medical terminology, postprandial. That means after eating, somebody feeling excessive fullness or burning or discomfort, all of them can be together said as heartburn. But mainly it refers to burning sensation or some form of discomfort in the chest area. Of course, if you are more than 50 years, if you are a smoker, if you have history of alcohol, if you have overweight, with these risk factors, first we should rule out a cardiac problem, because cardiac problem also can present with chest comfort with some problem like radiation or the pain going to your left arm or right arm, at the upper back, etc. So first rule out a cardiac cause. Then comes the most common cause for heartburn or chest pain, which is high acidity. In medical terminology, this is called as gastroesophageal reflux disease. That is, gastro is stomach, esophagus is food pipe. So from the stomach to the food pipe, that is esophagus, there is a reflux. So this is called as gastroesophageal reflux disease. Now, if you have more than twice such symptoms in a week, if it's associated with some other problems like weight loss affecting your quality of life, or if you have a family history of some dangerous upper GI, that is stomach related or food pipe related cancers, we have to be double careful. Usually we treat it with, first is lifestyle modification, then comes medications, and then comes procedures. So what are the lifestyle modifications for GERD? First is, you should have a stress-free life, a good sleep. You should be able to avoid smoking and alcohol. Third, in your food preferences, prefer having less masala, less spicy food, less of coffee, tea, bakery items or hyper processed food. Okay, this is important. Have small meals. Each meal can be sometimes followed by some curd intake to keep it as a little coolant, and then we can try some other lifestyle modifications, like you can try to lift the head end of your bed, try to have an early dinner. These are the things which we generally suggest for somebody having burning sensation in the chest or chest discomfort, and generally they tend to do well. Some of them who have excessive stress or who have raised sensitivity can have this kind of symptoms for normal acid secretion or some irritants in the stomach. Now these are people where we may have to use some medications. Few of the medications we reduce the acidity, some of the medicines we try to push the food forward to small intestine, some of the medicines can reduce your stress. So depending on the patient profile, based on each person's necessities, we try to alter between different medications. Sometimes after stopping the medication, again heartburns will come. These are patients who generally need further evaluation in the form of endoscopy, or there is a further test called as 24-hour pH-metry, which will tell us what is the exact problem for the heartburns that this particular patient has. Second, surgery. Not all of them require surgery. Few of them who have some conditions like hiatus hernia or some cancer might even require surgery. So surgery is generally the last step. Thank you.